Welcome to an online event brought to you by Parkinson's Community Los Angeles. Today, we are going to hear about mental health and Parkinson's. I am Angela Neff and I serve on PCLA's board of directors. For those of you who don't know us, we are a nonprofit that supports families living with Parkinson's through free events like this, support groups, meetings, and more. Today's Let's Talk Parkinson's program is brought to you by our generous sponsors, Abbott, Boston Scientific, Kiowa Kirin, Medtronic, and Supernus, and by donations from the Parkinson's community. If you appreciate what we do, please make a donation on our website at www.pcla.org. Thank you. Please join me in welcoming our speakers today. Lauren Keats is a neuropsychologist at Reactive Physical Therapy and Wellness, a neuro rehab clinic in Los Angeles. Her clinical training and passion lies in working with individuals and families affected by neurological disease and chronic health conditions. Dr. Keats provides both therapy and neuropsychological assessment services to understand how the brain has been differentially impacted by neurological changes, and to help individuals capitalize on psychological and cognitive strengths to improve their daily functioning and quality of life. Amanda Zendejas is a doctoral student studying clinical psychology at the Chicago School of Professional Psychology. While her primary passions have generally surrounded human sexuality, sex therapy, and working with the LGBTQ+ community, she is also extremely interested in how those identities may intersect with those affected by Parkinson's disease and other chronic health conditions. Welcome, Lauren and Amanda.
Thank you so much. We are so excited to be here. We are, as Angela mentioned, we are planning to talk with you all today about mental health and Parkinson's disease. As we will talk about, depression, anxiety, and apathy are really common non-motor manifestations of Parkinson's disease and are often overlooked. So we are very excited to talk with you today about how to identify some of these features and, importantly, how to treat them. And to give you an idea of what to expect for today, we plan to start with a little relaxation exercise. Relaxation really helps dampen the stress response and helps us maximize our attention and cognitive functioning, helps us learn and remember information and connect with others. So we plan to start with a short exercise, and then we're going to dive into what are the non-motor features of PD? What do they look like? And how might you identify them in yourself? Importantly, we will end with strategies for boosting mental well-being and living well with Parkinson's disease. We'll talk about there's a lot of different strategies that we can apply to really create balance and to live well, essentially. To get us started, Amanda is going to lead us in a brief relaxation.
All right. Thank you, Dr. Keats. I would love to start us off with a little guided imagery relaxation today. So if everybody could just sit back, relax, and close your eyes. Picture a relaxing place like a beach or a mountaintop or a forest or anywhere else that you might find peace. Imagine what you see, hear, and smell in your imagined oasis. And start to breathe in slowly. Allow the air to fill your lungs. And hold your breath for a moment, slowly releasing your breath as you continue to picture your surroundings. What do you see, hear, and smell? As you take another breath, feel any tension you're holding on to and let it drain from your muscles. As you breathe in and out, let go of any negative thoughts from the day. Free your mind of worry as you continue to picture your peaceful place. Draw from the serenity of the moment. Allow the calmness of your imagined oasis to wash away any worries you've had today and continue to drain any tension you're holding on to. Let's take a few more breaths, just thinking about what we see and hear. And know that you can visit here again whenever you'd like, whenever you need to feel relaxed and feel a sense of calm. You can visit other places as well. If you chose a beach this time, maybe you'll go to a forest next time. The choice is yours, but remember you can always come back for an escape from the tension and stress of everyday life. Taking a few more breaths to soak in that last bit of calm. And one more breath before we open our eyes. Okay. I hope that was enjoyable for at least some of you. And thank you for those that participated in that relaxation with me. We can go ahead and move on to the next slide.
All right. Thank you, Amanda. And for those of you that might not be used to an exercise like that, it is something that gets easier over time. It's common to have interruptions to the imagery exercise by thinking about what you're going to do that day or thinking about uncomfortable feelings. That's a completely normal part of how our mind works. With some training, we can learn to just refocus on the imagery when we've been pulled away. And we can build that muscle to help us really tune into calmness and pay attention for a sustained amount of time to something that is relaxing. But yeah, thank you for trying that with us. I certainly needed it. So I'm going to dive into discussing some of the non-motor emotional symptoms of Parkinson's disease. Approximately half of PD patients experience such non-motor symptoms like feeling depressed, feeling anxious, or feeling apathetic. The reason for this is we think that it's a combination of some of the changes to the brain, like changes in neurotransmitter levels of dopamine and serotonin and norepinephrine that go along with Parkinson's disease, in addition to just the burden of having a chronic illness. Right? It's stressful needing to ask for help for certain things, or it's stressful having fluctuations in symptoms that you might not be able to anticipate. And the stress associated with having PD can also put us more at risk for having some of these mood changes. The non-motor symptoms can actually precede the motor symptoms in many cases. So some people experience changes in their emotional health prior to even some of the motor changes of the disease. People with Parkinson's do tend to have higher rates of depression and anxiety than even other individuals with neurological conditions that cause a similar level of disability. So that does tell us that that it is inherent to Parkinson's disease. However, not every person experiences it. This is a more, I think there's a lot more for us to understand as to why this is happening. Without treatment, the symptoms can remain pretty stable over time. So for a person that has a low-grade depression, that tends to remain pretty stable. People that are more at risk for having higher levels of depression, that also tends to remain pretty stable. So we really do want to intervene and treat, even if it's in its mild forms. Depression is the most common, well, at least the most frequently cited non-motor complaint. However, it can be very difficult to identify. Some of the symptoms of Parkinson's disease, like slower movement or slower speech or flattened affect or changes in motivation, can look like depression, and therefore it can be very it can be easy for doctors to miss. Right? Your neurologist or your loved ones might assume that your symptoms are related to Parkinson's disease rather than depression. In terms of what depression feels like or looks like, it can look like a variety of different things. Overall, people report changes in mood, or feeling low, or feeling blue, or even just feeling more irritable than usual. It's also associated with changes in our routines, like we might sleep more or sleep less. We might have changes in our appetite, like want to be eating more or maybe eating less. It certainly impacts our concentration, makes it very difficult to concentrate, influences our thinking, our mood, and it can also cause changes in our mental status. What I mean by that is we might start to think about suicide. We might start thinking more about death. We might feel hopeless. If that is the case, it's very important for us to talk with our providers about those things, because as we'll talk about, depression is treatable, right? And those things go along with depression. Anxiety tends to be described as like a feeling of jitteriness, nervousness, or even worry. So we might worry about our health, worry about others, worry about being a burden. And while it's normal to have some level of anxiety, right, we all experience anxiety as a normal human emotion. When it starts to cause a lot of distress, or if it starts to impact our behavior or daily functioning, that's a really good indication that treatment would be helpful. So for example, an individual with anxiety might start to avoid social situations that cause anxiety. We'll give quite a few case examples as we talk today, so you'll get more of a sense of what that might look like. But the isolation that can ensue from that avoidance behavior can really have a domino effect of making depression worse, making anxiety worse, influencing our motor functioning and making our PD symptoms worse. And it influences our cognitive functioning as well. We all need to have a high level of stimulation to keep our minds working well. Apathy is something that's a little bit different than the depression and anxiety, and it tends to be more related to some of the neuropathological changes of PD. So because of the changes in the movement centers, less information can get to the prefrontal lobes, the very front part of our brain. With that might come changes in our cognitive functioning. And we might start to feel like a lot of loss of motivation and loss of apathy. We'll talk about some behavioral strategies for overcoming that, but talking with your doctor can also be helpful, because some of the medications that are used to treat cognitive difficulties will also help with the apathy. going to take a look at the chat. Okay. All right. So Amanda is going to talk a little bit about why it's really important for us to target some of these symptoms in psychological treatment.
Yes, as Dr. Keats was just speaking to, the non-motor symptoms of Parkinson's can be very common, as well as unrelated to Parkinson's, as Dr. Keats was just saying. And they can significantly impact our physical and cognitive functioning, our quality of life, and our relationships. Dr. Keats spoke a lot about depression. Depression can increase the risk of anxiety and other comorbidities as well, again, unrelated to Parkinson's. It can lead to more difficulties with executive functioning, like planning and organizing, multitasking, and difficulties in engaging in self-care activities, like hanging out with the people that we enjoy spending time with. Or doing things for ourselves around the home, or just activities in general that we enjoy. This can in turn increase the potential burden of other family members and care partners, potentially. So ultimately, non-motor symptoms can negatively impact the treatment of the process of PD in general, as many folks tend to experience low motivation, as Dr. Keats mentioned, and challenges taking medication, and less desire to exercise generally, or socialize or be productive. So again, it's critical to be able to identify these symptoms and treat them right away, because while we might not have control over our diagnosis, we do have control over our mental health symptoms. Next slide.
Okay, so we wanted to share a quote. This is excerpted from the Every Victory Counts manual, and I'll read this all to you. About 5 years into my journey with Parkinson's, I realized that I was getting really run down and it was hard to keep up. I was still working full time, and that meant long days, evening networking events, etc. It was starting to really affect how I felt. I loved doing all that stuff, but it was just killing me. I made the difficult decision to sell my business and went from being ultra busy to just nothing. I quickly found out that wasn't good either. Depression was something that happens to other people, but suddenly I realized that I was feeling really lonely. I got involved with volunteering and mentoring, and now life feels balanced. So I wanted to ask you all, what specific changes this person made in their lives to have more balance? And feel free to write this in the chat, or if anyone wants to, if anyone's brave enough to speak, that would be great as well.
I'll say something.
Great. Hi, Catherine.
Hi. Well, first, he was able to not be in denial. He was able to admit that it was killing him. It was just too much. And he decided to do something about it and found that that was too much the other opposite direction. So he filled it with an activity that was worthwhile for him, and it seems to have worked.
Yeah, thank you so much for your answer. That's a really great point. This person really took a close look at their behavior and their lifestyle and how it was influencing them. This person also had to have a lot of flexibility to make adjustments and to fine tune those adjustments. Wonderful, thank you. Okay, so we're going to talk, Amanda is going to talk about a type of therapy that's a really helpful form of therapy for individuals with PD. There's a lot of research support suggesting that altering kind of this pattern between how we're thinking about things or what we're doing can influence how we feel and help us create that life balance.
Yes. Thank you, Dr. Keats. Cognitive behavioral therapy, or CBT, is a type of therapy that's fairly structured in nature and has been, as Dr. Keats just mentioned, has been shown to be effective when it's used in conjunction with other forms of treatment for PD. So as people, we tend to respond differently and in a variety of ways to a single stressor, which highlights the significance and impact of our interpretation. This interpretation our interpretation of this something, right, of this experience, can be heavily colored by our mood, either currently, and our past experiences. Using CBT, we can help people learn practical strategies to navigate the challenges of PD and learning to live well. CBT focuses on the connections between our thoughts, feelings, and behaviors. It examines the negative thoughts we may have about ourselves, the world, and the future, and how those may relate to uncomfortable feelings of anxiety or depression, and how that internal experience may then impact our behaviors, like procrastination or social isolation, or maybe just having a lack of structure throughout our day or week. So essentially with CBT, we can help people identify the thoughts that contribute to emotional discomfort and replace them with more empowering choices. So oftentimes, our thought processes don't always serve us well. We can be very harsh with ourselves, and a lot of times we're more harsh with ourselves than we would be with other people or our loved ones, or our friends. For example, the thought that I am a burden as it relates to behavior may be associated with refusing help and staying indoors. Therefore, if we start to experience challenges completing daily tasks and just start to have a lack of meaningful activity, those types of things will start to exacerbate our depressed mood, which will in turn increase PD symptoms and likely decrease our self-worth and self-confidence. Therefore, changing behavior is a crucial aspect of treatment and a process that encourages the collaboration between patient and provider to implement structure and set achievable goals. Oftentimes, behavioral activation targets include things like goal setting, sleep hygiene, increasing pleasurable activity, safely increasing daily exercises, and hopefully increasing values-driven behaviors in general, because we want you to be doing things that you genuinely enjoy doing and find meaningful. We want to help you live genuinely well with Parkinson's. So that is the idea with behavioral activation, is doing the things that you want to be doing, and finding them meaningful in the process. And
Great. Sorry, did you want to say something
No.
else, Amanda? Okay.
no, I was just yeah.
Great. So this is an example of what we call a vicious cycle of thinking, feeling, and behaving. And this is something that you would work on if you were to have therapy with a CBT provider, is that we would better understand what your vicious cycle is, right? And while we can't suddenly feel better, we can't just not be depressed, we can intervene at these two levels. We can intervene at the level of thinking, and we can intervene at the level of doing, as Amanda was mentioning. So first, we're going to help you strengthen your understanding, or the connection between thoughts and feelings, because this isn't something that we learn about in school, or doesn't necessarily come intuitively to us. I wanted to ask you all how you think someone may feel with the associated thoughts. So if someone were to have the thought, my life is ruined, how do you think they would feel as a response? And again, feel free to write this in the chat, or you can unmute yourself.
Empowered.
Mm-hmm.
Okay.
Great. Optimistic, yeah. What about hopeful? Yeah. Mm-hmm. What about the next thought? There's nothing I can do about my symptoms. And Joe, you're highlighting really well how one thought may lead to another similar thought, right? These thoughts don't occur in isolation. They tend to kind of piggyback off one another. Depressed, apathetic, hopeless, more negative thinking, definitely. What about, I should just give up?
It's easier to do that than to do something about it. So it's less work.
Mm-hmm. Oh yeah, there's definitely benefits. So much easier. Definitely.
And also for the next time it happens, you don't have the tools. You're not practicing the tools that could possibly even help you a bit.
Mm-hmm.
So it's
Yep.
all a matter of practice. It's a practice also.
Yes. Yeah. So that's a great example of how negative thinking can really snowball, really start to feel worse, feel more hopeless, right? We're less able to solve our problems. So you might even hear that kind of thinking in others. Janet is mentioning in a family member being depressed. You really see that hopeless thinking coming through in interactions with people. What do you think about the thought, I can still have a meaningful life? If someone were to have this interpretation, yeah, Catherine, they might feel hopeful, grateful.
But it's not always the case. I mean, I don't always feel that I have meaning, but it's just a matter of, just like the weather, you have a darker cloud with storms and stuff and cold, and then if you hang on, it will change. So it's just gonna be patient with oneself.
Definitely. Yes. And that's a really great point. It is normal to have moments of feeling low and feeling depressed. Right? With that comes thinking in more negative ways. When that kind of thinking is persevering and it's lasting for more than a couple of weeks, and you're having a really hard time climbing out of it, that's when we start to think more of a depressive episode. So these fluctuations are completely normal. Yeah, and someone that's thinking like, I can't wait for my boxing class. I imagine they'd be feeling like a little excited. Anything else
It's like
someone might feel?
fake it until you make it. Works here.
Mm-hmm.
Like even if you don't feel so excited about actually
Yeah.
going through the motion of getting to a boxing class, it's just
Yeah.
you can maybe pretend. Teach yourself to pretend in these pretending in this aspect of life. Pretending is a positive thing.
Yeah, that we're going to talk about some behavioral activation strategies, which is the fancy term for what you just said. Right? It's acting as if you think differently or feel differently. And really that is so vital for feeling better and living well.
Also,
Because,
I think if we think that we're gonna be just like before, we're gonna get to nirvana, and this is, I mean, this would be an illusion, because we know that Parkinson is degenerative. We know that we're not gonna feel good, but how can we feel a tiny bit better? Not like completely eliminate, but just accept the fact that what's going on with us. I think that would make us, and would put us in a better place, I think.
mm-hmm. Yeah, thank you for sharing. Is it Rhonda? Is that how you pronounce your name? Okay, yeah, thank you for sharing. Yeah, and so I think depressed thinking can certainly make, Parkinson's disease trajectory much faster, right? It really exacerbates the symptoms. Anxiety and depression make the motor symptoms worse. And so this is something that you can do that's in your control to really slow down that progression and maximize your quality of life and your daily functioning.
But just
All
because
right.
you can't do it today doesn't mean you can't do it in an hour, or you can't. I mean, it's just you have to postpone
Yeah.
it. You have to postpone. You can postpone happiness
Yeah.
until you maybe physically feel a bit better. And we know that's like a seesaw.
Yeah.
1 minute you feel bad, 1 minute you feel good. But there are good
Yeah.
moments and there are bad moments. So it's accept
Yeah.
both, I think.
That's a really beautiful mentality and approach, Rhonda. So I wanted to share a case example. We could talk through the case of Linda. I'll read this aloud to you. Linda was previously very social and active. She enjoyed going to lunch with her friends, taking walks, and attending her weekly mahjong game. After receiving her diagnosis of PD, she started to feel ashamed and embarrassed of her tremor. She initially stopped going to mahjong, just telling herself that it would save her from the humiliation. She started to feel more and more depressed and eventually stopped going to lunches with her friends and even exercising. Her symptoms increased, which made her feel worse. At the insistence of her family, she agreed to start therapy. My question for you all is, what do you think might be going through Linda's mind?
Maybe thinking that she's not good enough to be around her friends or family because she's different.
Mm-hmm. Yeah, I could certainly see that, Paula.
She doesn't want to draw attention to herself.
Yeah. Yeah. She's embarrassed. Right? She's thinking possibly like there's something wrong with me. I shouldn't be in public. I'm gonna embarrass my friends. I'm gonna humiliate myself.
Society
Any
doesn't
other?
always make it easy for us to show our warts, you know, and you can't hide all your warts when you have Parkinson's. So it's
Yeah.
really understandable. It's something you really have to come to terms with.
Yeah, it's the feelings of vulnerability are coming up. Some insecurities. So I think you pretty much tackled or targeted a lot of the thoughts that I was thinking that she might be having. So things like, maybe I'm a burden, or my symptoms are shameful. I shouldn't be like this. I heard someone say, I'm different. Right? That's a really powerful thought for social creatures. It's important for us to fit in. Everyone will look at me. You're seeing she's having an anxious prediction about what would happen if she went to lunch. Just building up this idea of everyone looking at her. Maybe there's no hope, or the future's grim and I should just give up. You're seeing that the thought process that Linda is having is very different from how maybe you would talk to a friend that's experiencing symptoms. Right? If you're talking with a friend that was recently diagnosed and was adjusting to some of these new symptoms, I imagine you wouldn't tell them, stay inside, you're an embarrassment. Right? Or like, look at you, everyone's gonna stare at you. Why don't you just not go? Can you imagine like talking with any of your close friends like that? Yeah, probably not. Right? We tend to be like caring of people. Were you going to say something, Paula?
Thinking about how you, before getting your diagnosis, how you felt about people that you saw who had disabilities. And then you bring that on yourself, but I think you enlarge it though in your mind that it's worse than possibly what you were thinking of other people.
I think so, Paula. Yeah, we tend to be much more compassionate with others and really harsh and critical with ourselves. And we don't even realize we're doing it most of the time. So I think a big part of recovery and living well is recognizing some of these thought processes that we're talking about.
I'm usually a brave person. I consider myself, I did a lot of sports that were dangerous and stuff and lifestyle. But I think it takes a lot more bravery for me to actually have Parkinson and be in public and just face everybody's their eyes and the way they're talking about it or looking at me. So it took a while for me to actually be more brave in that that part of my life.
Yeah, thank you for sharing, Rhonda. I imagine others have had similar experiences with adjusting, right, and learning to use that bravery that you hold inside of you and apply it in this new way.
I find being around positive people is a huge help, because the more support you have, the easier it is. And it's hard for me to think of what would it be like to be around people who aren't not positive, or if you didn't have that source to be around. So you got to keep looking and looking for groups and places to be that make you feel good.
That's wonderful, Paula. Wonderful. So we're gonna share these slides with you all, by the way. So I don't think we're gonna have time to go over all of these, but maybe Amanda, you could just talk through a few of them, some ways in which you can, once you've identified, if you're talking to yourself in a really harsh and critical way, there's a lot of different strategies that we have for taking away some of the power of those thoughts.
Yes,
take over, Amanda.
Definitely. One of the ways that we can practice taking away that power, I always love using that phrase, by the way, is taking away the power, but is with self-compassion, right? Just practicing, what would I tell a friend if a friend came to me with this situation, or a loved one? How would I treat them, and what would I encourage them to do? Putting yourself in someone else's shoes can be a really easy way to kind of gain perspective and give yourself that kindness and patience that many of us, like we said, don't often give ourselves. Yeah, just
Maybe
examining the thought and its accuracy. Like, is this really what I'm experiencing? Is this really how I'm feeling? Or is it something else that's bothering me? Try to frame it from different perspectives if you can. Would be a good.
I think this first one is a good question as well. So just recognizing, how is your thinking like influencing you? Is it helping you, or is it actually kind of getting in the way of your values or your goals? I think Rhonda, you had mentioned bravery is potentially like an important value for you, a way in which it's important for you to act. And if you're having thinking that's taking you away from being that brave person that you want to be, then that's a really good indication that we should try to do some strategies to strip some of the power from the thought and not let it rule your behavior. Again, these are all strategies and things that you might work on in therapy. They're not necessarily easy to do for yourself, but we're just hoping to give you an intro to some kind of basic therapy strategies. Another,
sorry,
yeah,
just one.
That's okay.
If I may,
Please, Rhonda.
a quick thing. It's because there's something with all the rules and the laws that came in, the titles with the ADA, about accommodations in the workplace and different places. Well, are we accommodating ourselves? Like, are we giving accommodations from what we were doing before and who we are now? I just thought about it now, that we have to accommodate. We have to make changes so we're more comfortable, just like we expect others to accommodate us, to give us railings and this and that. I think we also have to accommodate our own changes.
Oh, that was so beautiful. I love that metaphor. Yeah, it's easy to think about it. If someone has a broken leg, you would make accommodations for them in the workplace and move their desk closer to like the bathroom and water area. It's just so simple to think about when we think about someone else. But when it comes to ourselves, it can be hard applying those. But you really highlighted the importance of flexibility, being kind to yourself, and giving yourself grace.
Yeah.
And another strategy we can use is a mindfulness strategy of kind of letting some of your thinking go. We're not going to have time to do an exercise today, unfortunately, but what I can do is I can send an example in so when you get the presentation, you could do it for yourself. What this exercise is it's a guided imagery exercise in which you imagine yourself sitting next to a river with leaves floating along the surface of the water. And for a few minutes, you can practice placing every thought that comes into your mind onto a leaf and just watching it float away. This practice helps us give ourselves some distance from our thinking, especially when we go into this like thinking mode or analysis paralysis mode. It can be hard to be attuned to the environment and really benefit from being around others and doing things. So I think this is a very important skill to build, and I'd love for you all to try it if you're open for it, open to it. In our last few minutes, though, we are going to talk about just the importance of setting goals and some other kind of strategies for optimizing mental health.
Yes, and as we have been talking about, behavioral activation is an important part of treatment. All of the people living with Parkinson's with whom Dr. Keats and I both work are encouraged to set 3 realistic and achievable goals per day, including 1 exercise goal, 1 social goal, and 1 other goal. So in a minute, I wanted to touch on something you mentioned, Rhonda, which was that accommodation factor, right? That idea. And I love that you said that, because I wanted to also say that adapting to an illness does require being flexible and open-minded about things. And sometimes that does mean shifting the bar a little bit to just change it up, right? And there is nothing wrong with having to shift the bar or wanting to shift the bar for whatever the reasons may be. So as long as you're being mindful about those reasons and again aligning those with your values, ideally. So as a group, and I don't know if we'll have too much time for this, Dr. Keats. You have a better idea than I do, but we wanted to have y'all think about 1 exercise goal, 1 social goal, and 1 achievement goal. Maybe if we don't have time to actually identify one as a group together, you can think about it as we kind of head into the next part of our day together. What do you think, Dr. Keats?
Yeah, I don't think we'll have time to really all talk about it as a group, but maybe we could just take a moment for you all to think about like something that you would like to get out of today while practicing kind of shifting that bar and being flexible and compassionate. So given how you're feeling today, is there something you would like to do, like maybe call a grandchild or pay a bill? If anyone has any examples, something that comes up for them that they would like to share, I'd love to hear it.
Apply for a job.
Oh, wow, that's a big goal. Do you have some jobs that you're looking at already?
I do. They're out there. I just have to start applying.
Okay, so that's a great example, Rhonda, of sometimes we can have like very big goals in mind, and they can be hard to achieve them within a certain amount of time. And so we can work on really making that goal something that's realistic for right now. A way we could do that is, say, like set aside 30 minutes to research goals or research jobs, sorry, right? Or create a list of 10 potential ideas. right? We're making it something that we can check off the list and achieve. And that's going to be motivating in nature. So give us some dopamine. Can you think of a way that you might make that realistic for today, Rhonda?
Shorten my to-do list and just focus on what's more important.
Okay.
It's interesting because there's a work technique of being productive at work where you choose 3 things. You're going to just get 3 things done today because usually at work you have 100 things to do. And I actually just started doing this in my personal life. I retired in June, and I love these exercise social productivity, narrowing it down into those specifics. But I've been doing that. It's been really because I got the 3 things done.
Yeah.
It's nice, just like at work.
Yeah. That's
Good
amazing,
idea.
Angela.
Thank
And,
you.
and then reward yourself.
Yeah.
Yeah.
Now we're talking. Definitely. Yeah. So we want to stay away from some like ambiguous goals that are really, really big. Because like you're saying, like you don't get a sense of achievement when you have 100 things to do and you only tackle 3 of them.
Yeah.
But if you have the goal of accomplishing those 3, that's reasonable. And we get a huge sense of achievement and motivation and dopamine when we're able to actually accomplish what we set out for. Thank you for sharing. Broadly, we have some strategies here to optimize mental health. These are all things I imagine you've heard about before. The importance of seeking help, asking for help if you're identifying some of these symptoms in yourself and you're seeing that there's room for improvement in your mood or how you're going about things. Of course, regular exercise routine is so important. I know you've all heard of that recommendation. Just the benefits are so huge. In addition to social connection, the pandemic really showed us how important social connection is for us, for our health and our mental well-being. Relaxation is really important. We're so used to being on the go and accomplishing things and doing more and more, and making time to put on the brakes and to calm ourselves down is really important. Monitoring the information that we're receiving. If we're spending all day watching the news, that tends to be depressing, right? While it's important to be informed, or might be important for us to stay informed, turning off the news is sometimes like the best decision we can make for ourselves for that day. Regularly engaging in pleasurable activity, using your sense of humor and laughing, and just making smart lifestyle choices are all things that tend to support our mental health. And I'd like to just ask if anyone has a few moments for questions. I previously wanted to ask this question, but I don't think we're going to have time. So maybe something you can just think about is what you're doing, what's working for you. If there's anything we've discussed today that you think that would be helpful to add on. And I'd love to answer any questions that you might have as well. Here's some mental health resources that you'll all receive.
Well, I just have one last comment, and that is I was really glad to see information hygiene on your list. I think that's something that is such a powerful thing. It can be very positive, it can be very negative, and something I've been watching myself, and I have friends who I want them to start watching it too. That was a great one.
Yeah. Yeah, it's amazing when we start paying attention to the information that we're receiving. It's all over. It's people that we're talking to are talking about negative things that are happening. It's on the radio, on the news. It's conversations that other people are having around us. And we can certainly be bombarded with a lot of negative information, which could feel really depressing. Oh, thank you, Joe.
Okay.
Well, thank you so much for having us. Sorry, Angela.
Thank you, Dr. Keats and Amanda. Okay. Thank you, everybody, for joining us today. We have some great events coming up. Later this month, we'll be hearing about the latest advances in deep brain stimulation for Parkinson's, and we'll be joined by another neuropsychologist who will talk to us about staying connected to the Parkinson's community. Links for these events and all of our programs will be sent out to our email list. Today's event was made possible by our sponsors Abbott, Boston Scientific, Kyowa Kirin, Medtronic, and Supernus, and by you. By donating to PCLA, you can join us in our mission to improve the lives of the families in our community who are living with Parkinson's. PCLA is a nonprofit, and all donations are tax deductible. If you enjoyed today's program, please consider donating at PCLA.org to help us continue to provide programs like this for free. As always, reach out to us with questions at info@pcla.org or by phone at 310-880-3143. Thank you, everyone. Have a wonderful day.